Welcome, viewers. At first, introduced myself. I, Dr. Subimal Krishna Saha, a professional homeopath in the field of homeopathy, a registered practitioner from the Council of Homeopathic Medicines, having the teaching experience of different colleges of West Bengal. My today's topic is the burning problem of the world, the Covid-19 coronavirus, the terror. Against this terror, this monster, the acceptance of homeopathic medicines. Regarding this, at first, I want to mention here the notifications of UK National Health Service. They have collected the symptomatology of coronavirus affections. Along with they decided and they came into conclusion that antibiotics are of no use. The antiviral drugs, what they have against flu, will not work. There is no currently vaccine available for coronavirus. Then their conclusion is recovery depends on the strength of the immune system. Recovery depends upon the strength of the immune system. Regarding this point, I want to enlighten here how the homeopathic medicines act. And in favor of this immune system, I want to say that homeopathic medicines are not so-called antibacterial, so-called antiviral. Then homeopathic medicines applied to a patient according to the symptomatology of the patient. That is symptomatic treatment, not only symptomatic, that is symptomatological treatment of the patient. And when a homeopathic medicine acts, it will no doubt enrich the immune system. It will boost the immune system. And homeopathic medicines, after having enriching the immune system, the body itself driven back the disease with all its roots. It's a proven fact. There is no doubts about these documents. Then come to the symptomatology of the coronavirus. So have the symptomatology we have found in China authority, that there is dry cough, there is sore throat, there is aching pain in the bodies along with high fever and later on severe respiratory distress syndrome. And that is the sensation as if feeling like drowning in water. Almost all the authorities accepted these symptoms along with the who added that there is maybe running nose along with diarrhea. Italian authority also said about these symptoms along with to some extent running nose. So come to the symptomatology of the patient. Following the symptomatology of the patient, it is no doubt we have the drugs. Suppose we have the arsenic group of drugs, so-called arsenic album, arsenic iodatum or arsenic sulflavum. We have the Rostox, and only for dry cough with fever we have the Drosera, which had been proved before that act very beneficially for the mankind. Then come to the individualization of the patient. If that pain throat is relieved by application of hot water, then Rostox or arsenic group of drugs will be much beneficial, it is no doubt. If that patient becomes restless with the fever, then Rostox may be the drug. So we can concise ourselves that this group of drugs will be more beneficial for the coronavirus affections. I appeal through via authorities of government that please let me allow to take the case of coronavirus patient in West Bengal, just to find the exact genus epidemicus. I am not going beyond our master handyman. That every prevailing epidemic disease must have to judge by observing the cases on the field, and it is my duty to observe the patient in the field and take their proper symptomatology and proper individualization of the patient, because epidemic diseases are so-called contagious disease. That is why they always bring the fixed group of symptoms. That is why homeopathic medicines can easily found the genus epidemicus. Our allopathic friends also treated the patient according to the symptoms. With the homeopaths, we also tried to patient along following the symptomatology of the patient. So there is no tussle between us with our allopathic friends. We do work side by side. We do work like a friends with them. Hence, it is our humble proud to our request to our Chief Minister, our Prime Minister, that we must agree that your decision is very nice for isolation of 21 days. It is a very nice decision, because to break the chain of coronavirus, it is very necessary, because now almost 4,25,000 people are attacked by coronavirus throughout the world. Near about 18,000 death crosses. We have to pay much toll for this. And we must see that the death rate of Italy has proved that the immune system enrichment is very necessary to fight against coronavirus. So, first of all, isolation of the patient. Second, to break the chain of the coronavirus. That is why quarantine homestay of all people of India. This is very good decision. And last, to find a genus epidemicus for that prevailing epidemic disease. Because throughout the history, past history, we have found that whenever any epidemic disease prevail in the world, homeopathic medicines have served an unique role for Cuba, for plague, and for Sydenham scarlet fever, and etc., etc., etc. No need to details about that matter, but this is our request to our Chief Minister and our Prime Minister. We the homeopaths, we are with you, and we are with you. Please take as a soldier with you and at the side of you, and we can assure you we must give some service. We must give our service to the nation for our last drop of blood and for the benefit of mankind, of the human being. Thank you very much. Thank you all of you. Stay well, rest well, remain well. Thank you.